guests, esteemed colleagues, and future pioneers of education. Greeting. I'm Dr. Taniya Wadhwa from Department of Physiotherapy, Chandigarh University. It is truly an honor to speak before you today at the Global Edu-conclave 2025 on a topic that is crucial not just to the future of education but also to the health, well-being and sustainability of our global community. Interdisciplinary research for a sustainable future with a particular focus on the field of allied health sciences. In a world where we are grappling with complex interconnected challenges from chronic illness and aging populations to mental health crisis and healthcare inequalities, the need for innovative solution is more urgent than ever. However, these challenges cannot be addressed by any single discipline working in isolation. Instead, we need collaboration, not just healthcare professionals, but across a wide spectrum of fields science, technology, engineering, policy, and social sciences. There is where interdisciplinary research comes in and where the allied health sciences, including fields such as physiotherapy, occupational therapy, public health, radiography, nutrition, and many more, play a pivotal role. By working together with other disciplines, we can create holistic solutions that not only improve health outcome but also contribute to the sustainability of healthcare systems around the world. The need of interdisciplinary research in allied health sciences. Let us begin by understanding the inherited complexity of healthcare challenges, particularly in context of allied health sciences. Allied health professionals, by definition, support the prevention, diagnosis, treatment, and rehabilitation of individuals facing a wide range of health conditions. The scope of their expertise is vast, touching everything from physical therapy for those recovering from injuries to nutritional counseling for managing chronic diseases like diabetes. However, these professionals often work in isolation with their respective fields. Interdisciplinary research bridges these gaps, bringing together diverse perspectives and expertise to address health challenges that affect individuals, communities, and entire populations. For instance, we think the global aging population presents significant challenges in areas such as chronic disease management, disability, and rehabilitation. These problems requires input from not only the geriatrics and physiotherapy but also social work, public health, medicine, engineering, all working together to create sustainable, comprehensive care models. Allied health professionals must collaborate with healthcare providers, technology experts, and policymakers to ensure that aging is in place. Living independently at home for as long as possible is a viable option for elderly individuals with proper care, mobility aids, and community support. The key to resolve and these types of problems lies in interdisciplinary collaboration. The first one was holistic healthcare solution. Allied health sciences are at the heart of healthcare approach that is increasingly seen as essential for improving patient outcomes while medicine treats the disease. Allied health professionals focus on the whole person health, their function abilities, well being, and quality of life. For example, a patient recovering from a stroke may need physical therapy, but they also require nutritional support, psychological counseling, and social interactions integration to regain independence. Interdisciplinary research allows for a deeper understanding of how factors such as diet, exercise, and mental health interact in healing process. Through collaboration across multiple fields, we can develop integrated care plans that address all aspects of a patient's recovery, leading to sustainable health outcomes. NAP 2020, we talk about this. NAP 2020 also advocates for a holistic approach to education, encouraging collaboration between disciplines. The context of allied health sciences, the philosophy extends beyond the classroom into clinical practice and research, encouraging students professionals to think about health in a broader concept. So next topic that we're talking about is addressing complex public health issues. Public health challenges like obesity, mental health, and pandemics are not limited to one intervention. They involve interconnected factors ranging from social determinants of health to genetics, behavioral patterns, and policy decisions. The COVID 19 pandemic, for example, that highlighted the importance of collaboration between epidemiologists, infectious disease specialists, mental health professionals, and community health workers. In case of mental health, allied professionals such as occupational therapists and psychologists work alongside public health experts, sociologists, and policymakers to design the intervention that prevent mental health crises and improve access to care and reduce the stigma. Interdisciplinary research can help to identify innovative ways to integrate mental health services into primary care, schools, and workplaces, ensuring the health system that are equitable and sustainable. Technology integration for healthcare sustainability. The future of healthcare depends significantly on technology, from telemedicines to assistive devices for people with disabilities. However, the integration of technology into healthcare requires input from a wide range of fields. Engineers work on the design of the technology. Data scientists ensure the system works seamlessly, while allied healthcare professionals like speech therapists and rehab experts ensure that technology is user friendly, accessible, and effective in improving patient outcomes. In fact, most of these groundbreaking innovations in healthcare today were wearable health devices, AI driven diagnostic tools were born out of interdisciplinary collaboration between healthcare professionals, engineers, and data scientists. As the NAP 2020 emphasizes, it's not enough to develop new technologies in isolation. We must ensure that these technologies serve the real needs of patients, particularly in undeserved or rural areas. Role of education in promoting interdisciplinary research in allied health sciences. To make the vision of interdisciplinary research a reality, we must look at the role of education also. The NAP, the National Education Policy, NAP 2020, outlines an approach that emphasizes flexible curricula, multidisciplinary learning, and a shift towards integrated education. These principles are especially relevant to the allied health sciences, where the challenges of healthcare require not only clinical expertise but also knowledge to social system, public health, technology, and policy. The NAP 2020 stresses the importance of breaking down academic silos and encouraging students to take holistic view of problems. For instance, a student pursuing a degree in occupational therapy should expose to public health, sociology, and technology to better understand how to design an intervention that are not only medically effective but also socially inclusive and technology feasible also. Moreover, the interdisciplinary research can be supported by joint programs and collaborative partnerships between universities, healthcare institutions, and industry, allowing for practical expertise in developing sustainable health solutions. A vision for the future of healthcare and allied health sciences. As we move forward, the integration of interdisciplinary research in allied health sciences is not merely a luxury. It is a necessary for building sustainable healthcare system that can meet the challenges of the future. Through collaboration, education, and innovative thinking, we can bridge the gaps between the disciplines and create healthcare models that are holistic, equitable, and sustainable. By embracing the vision of NAP 2020, we can shape an education that equips future healthcare professionals with the skills, knowledge, and mindset to work across disciplines, ensuring that our health systems are equipped to meet the needs of every individuals everywhere. Let us commit to fostering interdisciplinary research and collaboration in allied health sciences to build a healthier, more sustainable world for future generations. Thank you.